Welcome back. We're still looking at Malaria Day, and this time we're taking the discussion to Zenith Pharmaceuticals Limited. It's a private limited liability company registered in 2000, and it has a staff strength of about 60 people, and it serves as sole representative of various overseas pharmaceutical companies, and all its products happen to be NAFDAC registered. We have with us the GM Sales, Emeka Nwachukwu, who is a pharmacist. Good morning. And we also have the hospital specialist rep, also a pharmacist, Mr. Godwin Emebina. Good morning.
Good morning.
Thank you very much for joining us this morning. Tell us about the kind of anti-malaria which comes from your stable, since we're still talking about Malaria Day, which happened yesterday.
Okay, thank you very much. Like you just said, Zenith Pharmaceutical Limited is an indigenously Nigerian pharmaceutical company, and we represent the interests of the best brands put in various parts of the world. Basically, the WHO at the turn of the decade, they recommended certain kind of anti-malarias, okay, certain combinations, ACT-based, artemisinin-based combination therapy. And there were certain criteria for the adoption of some of those anti-malarias. Basic among them is adequate clinical and parasitological response, okay? The product had to provide the clinical resolution of the symptoms of malaria, and then the clearance of the parasite mass in the body was also very important. So, after several researchers came out with a unique product, Camosunate, that's the name. Camosunate is a brand of amodiaquine artesunate, which of course is also part of the first line recommendations by WHO. And what is unique about ours is that it comes in four age ranges, okay? And taking into consideration the socioeconomic realities of our climb here, we
It comes in
4 age ranges.
Oh, age
ranges.
Okay,
yes,
okay.
yes. And then that was predicated on the fact that we have peculiar challenges in our environment. Apart from principal among it is the literacy level, okay? And then so as soon as this product was removed from the exclusive list of prescription products, because you could now go and buy it, we had to provide a product
over the counter.
Yes,
Okay.
we had to provide a product that would be easily accessible, and then without putting too much in common. Basic among is the fact that it comes in 4 age ranges. Like I said, we have the one for neonates, we have the one for children 1 to 6, 7 to 13, and adults. And all of these have its own unique presentations.
How many tablets do I have to take as an adult?
Okay, as an adult, what you just need to take is, like I said, there are two. The components are two: amodiaquine and artesunate. Okay, you take one of each component 2 times a day. Okay, as an adult. But as a teenager, you just one daily for 3 days.
Okay.
Yes.
Mr. Mebina,
Yes.
does this drug have any side effects?
Yes, the major side effect that is experienced by most patients is drowsiness as a result of neurological effects of the drug, drowsiness and lethargy. And this side effect can actually be overcome by patient monitoring and advising the patient to take lots of food, lots of drinks, energy drinks before taking the drug.
Energy drinks, did you
Yes.
say?
Not in the sense that
Not-
you take.
Yes.
Energy providing drinks.
Yes,
You know, energy providing.
because of the hypoglycemic effect of the drug. That's why you have to take
So,
some foods, to
okay,
Yes.
water alone won't do it.
No,
what I know we do it. No.
Okay. Okay. So can a pregnant woman take this?
Well, you know, as with most drugs, we want to rely on the expertise of your doctor. But there has been nothing to prove in recent times that it cannot be taken by a pregnant woman. Yes.
So a pregnant woman on advice
Advice
from
of
the
the
doctor.
Yes.
Okay.
Yes.
The national policy on malaria treatment stipulates artemisinin.
Artemisinin-based combination therapy.
Yes, yes.
Artemisinin-based combination therapy, yes.
Is this drug compliant with that recommendation?
Yes, that's what I said earlier. the current trend is to use artemisinin-based cosmetic. Artemisinin is a Chinese herbal product in artisanal, and it was being used decades ago. Okay, the prognosis looked well, and then it's been adopted. And like I mentioned earlier, the basics for that adoption was that adequate parasitological clearance, adequate clinical resolution of the symptoms, and camosunate suits that. Camosunate, the amodiaquine in camosunate has high level of parasitological clearance. Okay, the artesunate has high onset of action. So it meets that. That's why I said earlier it meets that WHO standard, and that's why we encourage people. In fact, it stands out a little bit because for us, the camosunate content has shown tremendous progress. It has shown adequate capacity, and that's simply because, unlike other anti-malarials, okay, under molecules, it stays in the body a little bit. I'm not saying it provides immunity. No, there's no immunological response to malaria. But if you have something that will stay in your body probably for up to 30 days, chances are that you probably won't come down with malaria. Because the problem is that as soon as you get bitten by the female Anopheles mosquito, chances are that you come down with malaria anyway. There's no immune response. Yes.
Now, some doctors are returning to chloroquine, and they're saying that some malaria parasites are resistant to these ACT drugs. What's your comment?
Okay, resistance to ACT drugs, for example, it's not necessarily all the ACTs that some we're having resistance, because our drug provides a longer protection because of its half-life of over 30 days. So it stays longer in the body than most other combinations. So it's also unique in the sense that the artesunate component and helps for the clinical cure in terms of attacking the parasites, the merozoites in the red blood cells. But there's also the radical cure, that is to eliminate the latent forms to prevent relapse of the infection, which is provided by the amodiaquine component. So our drug, I don't think they will.
Yours is not in the category of ACTs that.
Yes.
Okay. Now, what other major drugs, I mean, common ones that people normally use on a daily basis, come from Genif?
Yes, in our portfolio, we've tried to, like you said, have quality products that are peculiar to certain disease conditions for us. We have antibiotics in our climb. We have Nosclav, that's amoxicillin clavulinic acid. We have Pulmocef, which is cefuroxime. These are high quality antibiotics. We have analgesics, phenol, diclofenac potassium. We have, the regular blood supplements like Iron Dex. We have it both in capsules. And then we have the triple action cream, that removes skin blemishes, Tribact. And a whole lot of
skin blemishes.
Bleaching cream.
Okay.
No, not bleaching cream. Not bleaching cream. Not bleaching cream. But the skin is exposed to the harsh weather realities of our environment. So Tribact is something that gives you some sort of protects it. And if you want to say keeps your skin the way it was made by God, then that's
the right thing. Well, somebody on Twitter just said something here. He said, please, what's the malaria treatment combination that wipes malaria off when you have it?
When you have it?
Yes. So what would be the treatment combination from your stable, the kind of medication you say
without sounding modest, I stand bold to say that most cases of malaria have succumbed to camosunate. And scientific studies, Professor Mobarel is a consultant. In fact, right now he's a consultant for primary health care in Rivers State. He's a professor in University of Benin Teaching Hospitals. Dr. Iago is also a lecturer in that. They did a study over a period of 6 months to 8 months, thereabout, and then they were looking at the efficacy and safety of camosunate in University of Benin Teaching Hospital. And the result it was so marvelous. I mean, 96% in terms of efficacy. There was no withdrawal. Of course, when you're doing studies like that, chances are you might need to withdraw because of side effects. There was no withdrawal. The cure and efficacy was 96%. And the WHO benchmark, if you consider the fact that WHO benchmark for adequate clinical and pathological response is 75%, then 96% is way up there.
That is
In other
pretty
words,
much excellent.
Go and use camosunate.
So that's a
I even wish
that's
we
a
get-
That is the
message
long and short of
for
it.
Yes,
Kema
yes.
Konam Ofang, who is on Twitter asking this question.
Okay, now quickly, just before we go,
right.
what is Geneth's CSR initiative, especially using this drug?
Yes, yes. And as it were, in our immediate environment, we're at Oshodi. In our immediate environment, most of the government schools there, we've partnered with them, we've supported them during their inter-house sports. Inter-house sports program, we usually have a stand where we advocate for prevention. I mean, realistically, that's what we have. But of course, things do happen sometimes. We also offer treatment. And then we've supported researches, we've funded researches in the public interest that has to do with malaria. We've organized workshops in our vicinity. Most pharmacy shops around our vicinity, they are sales boys and sales girls. We've organized workshops. We've tried to pass the information, prevention as it were. Even though we're a pharmaceutical company, we have a prevention. And then we've also intervened when need be. And prior to this, as a prelude to this World Malaria Day, through our social media platforms, we've been giving out informations on daily basis, and then we've also tried to, provide those needed informations. Like I keep emphasizing, that will emphasize prevention as against curage.
Now, Godwin, in closing,
Okay.
it seems like Ebola is coming. Well, it's spreading on the West Coast, and we pray against it, but it looks like it's a matter of time before it reaches us.
Yes.
Is Geneth worried about this, and what are you doing in advance of it reaching our borders?
Okay, we are concerned about it, and through our social media, and as we are here, we try to we don't have an antiviral for now, but we try to.
There isn't any cure.
Yes,
Yes, we are concerned about it, and we hope and pray that there will be that with time we'll come up with.
In addition, we know basically what we're trying to say is we prevent, okay, good health habits. I know we disseminate information. If you're traveling to the West Coast, be careful. Just make sure that, because basically it's just transmission. If you can break that transmission chain with good health habits, sanitation, topmost priority, I think by God's grace we won't have cause to have cases.
Do you make any purifiers?
Oh, no.
Sanitizers?
No.
Okay.
No.
Well, thank you very much.
Yeah.
Zenith Pharmaceuticals Limited. We have been chatting with Emeka Nwachukwu, who's the GM sales, as well as the hospital specialist rep, Mr. Godwin Emebina. Thank you very much for coming to talk to us.
Thank you.
To mark this occasion of World Malaria Day.